enter the room.
I'm Dr. Shegun, the doctors in the clinic today. Please, can you please confirm your age and name for me?
I'm Emily. I'm 32.
Okay. Hi, Emily. Nice seeing you today. I cannot help you.
Well, I'm here for my postpartum checkup, but I also wanted to discuss, discuss something around quitting smoking.
Okay. So, congratulations on your delivery. How is your baby doing today?
Oh yeah, she's doing good. She's doing absolutely great. Thank you for asking.
That's nice. Okay, so you made mention that you want to ask questions as regards smoking, right? Is that right?
Mm-hmm. Yeah, that's right.
Can you please tell me what you want to know?
Well, doctor, I've kind of resumed smoking after my delivery, just a few weeks after that. And I know it's going to have some kind of an effect on my child. I realize that, and I don't want that for her. So I'm looking for ways to quit. I just feel I lack the willpower to.
Okay. It's a good thing that you're here today, and we'll try and do our best to ensure that we help you with what you want. Is that okay?
Mm-hmm. Yeah,
Okay.
sure.
Yeah. So I would just like to ask some questions. Is that okay by you?
Sure.
Okay. Yeah. So as regards smoking, for how long have you been smoking now?
Well, technically, I've been smoking for about 15 years, but I stopped during pregnancy.
Okay.
But 2 weeks ago, I kind of started.
Okay. Yeah. So like how many cigarettes do you smoke, or what do you smoke?
Well, I smoke tobacco and about 2 to 5 cigarettes, I would say, in a day.
Okay. Okay. So is there anything in particular that makes you increase the is there anything in particular that actually makes you want to smoke?
Well, initially it was peer pressure, but now
Okay.
since I've gotten started again, I'm finding it difficult to quit.
Okay. Okay. So while smoking, is there anything, maybe situations that make you to not want to smoke?
I'm sorry, what is that again?
Or are there times in which you don't want to smoke? Like other things that you do that don't like make smoking attractive to you?
Well, I don't want to smoke. I probably, especially since, I've had the baby, and when I think about her health concerns, I kind of don't want to, but then I think I lack that willpower.
Okay. 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 Yeah. Okay. Just to ask, have you been losing weight like unintentionally?
No, not that I've noticed. I've put on a
Okay.
few after my delivery.
Okay. Any yellowness of the eyes?
I'm sorry, any what of the eyes?
Yellowness of the eyes?
No yellowing, no, nothing like
Oh,
that.
okay. Okay. Yeah. So okay. Thank you for answering all my questions. I'd just like to ask you some questions around your general well-being. Is that okay by me? Is that okay by you?
Sure, sounds good.
Okay. Do you have any medical condition?
Oh, no, doctor. I've been perfectly fine.
Okay. Have you had surgeries done before?
Oh, no, doctor.
Any
I
allergy? Okay.
no, no, no allergies.
Okay. Okay. Um. Any is there any medical conditions that run within your family?
No, nothing that comes to mind.
Okay. So just ask you some questions around your lifestyle. Is that okay?
Sure.
Okay. Yeah. Do you drink alcohol? Do you drink?
I used to, but ever since I got pregnant, I've not touched any.
Okay. Okay. Do you do exercise?
Yeah, from time to time, but I'm not very consistent.
Okay. I would just like, okay, thank you for the answers. So just ask, what's your major worry as regards this smoking?
Mm-hmm.
Do you have any major worry as regards the smoking?
I
As
mean,
regards why you are here? What you
yeah,
saying?
it's because of my child's health, especially
Okay.
so little.
Okay. Yeah. So is there anything you're hoping we'll be able to do for you today?
yeah, if you could come up, if you can help me with some strategies, if there are any medications I can use, because that craving is something that I want to get rid of.
Okay. Yeah. So just before, thank you for all these informations, but just before we discuss about how to do that, I would just like to do some examinations. I will do that in terms of a chaperone respecting your privacy. Is that
Mm,
okay?
sure, absolutely.
Yeah, so these examinations will involve me doing your I'll do a basic observation. I'll check your vitals, your pulse rates, your blood pressure. Then also I'll just do a quick general physical examination. Is that fine?
Sure.
Okay. 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 Thank you. From everything we've discussed so far and from the examination, everything seems normal. However,
Mm,
you made mention of, okay, you want to stop
2 minutes
smoking.
remaining.
Okay,
yeah.
and we appreciate your concern. So also so there are actually ways in which we can go about this. And
Mm,
so yeah, so there to stop smoking, I will want to refer you to we have our smoking cessation groups whereby they can help you, to put you through the phases of how to stop smoking, and also they have a group where they can help you also to feel better about all this. Is that okay? Does that sound like something you can do?
yeah, that sounds nice. But if you could give me something that, like some medications, that could help me. I mean, I'm kind of breastfeeding, so I hope it could
Yeah.
be safe. Well,
Yeah, so although we have patches and we have replacement medications that we can use, but because you are breastfeeding and your baby is about 6 weeks, after is about 6 weeks old, so we don't want to give anything that could be harmful to your baby as at this moment. However, we could refer you to the specialists, the clinical psychologists, where they can help you through all this.
oh, okay. I mean, there is nothing that I can take, no medication. You spoke about a replacement. What exactly will
Yeah, so the replacement normally is more like a nicotine replacement patch, but however, because you're breastfeeding, we won't want to give you that now because if you take it, your baby could get it through breastfeeding, and we don't want anything that will be harmful to your baby.
Okay, okay,
Yeah,
doctor.
yeah. However, there are forms of therapy, talking therapies that the psychologist can help you with, and we believe that this will be safer for both you and your baby at this period.
Okay. Yeah,
Yeah.
Move on to the next station.
good job, Dr. Sajjan. That's great. That's great. Awesome. All right, a couple of things that I wanted to highlight. So let's look at the question quickly, right? She's attending, who is your patient? She's a postpartum lady who is attending postpartum care, right? So what did she start with? I've come for follow-up. Did you ask me any questions regarding my follow-up?
No.
So that's something you need to get out of the way as well, right? Even though there is a concern of smoking, you need to quickly ask her questions of how is your postpartum health been? Have you been having any discharge that could be, foul smelling? Have you been able to resume your daily activities, right? Are you breastfeeding? That's very important. Because the main thing over here is you are going to be talking about this, but you're also making sure that she's fine postpartum, right? Because she's come for a postpartum checkup, follow up. We've not spoken about that at all, right? So understand the question, like understand the setting. If you are in this kind of a setting, what would be the major things you'll have to tick off, right? The postpartum checkup you ought to do. You need to understand if she is experiencing, any foul smelling, discharge, from her vaginal discharge, right? How is her baby's health and development? How is her feeding happening? Is she able to breastfeed? Is the child latching on properly? Right? Is she fine overall postpartum? And then go to talk about the smoking cessation. Yeah.
Yes.
So that's one important thing that I want to highlight. Otherwise, you asked a lot of good questions around smoking cessation. That was good. You understood the trigger. You understood how much the smoking is there. Yes, Dr. Hafsa, I'll come to you one moment. I'll just finish this thought. But one other thing is, how do you, now you want to get out from her is how exactly do you think it's going to affect your baby? So that you understand what is her understanding of the risks, and you can supplement the rest of the information of what she doesn't know in your management on how this could affect your baby. Because if you feel your baby is starting to have the symptoms, you can come in sooner than later, right? Because she just knows that there will be adverse effects, but she has no idea what the adverse effects are. So you can ask her, like, what do you think are going to be the health risks, so that you can inform her about it.
Okay.
Right. Now, you need to also understand if the baby is actually exposed to the smoke, where does she smoke? Right.
Yeah.
Because even though you're going to give her a lot of
Yes.
advice to help her stop smoking, what if she falls back into that habit? Right. There could be, you can add it on as a safety netting where you can actually mention that, why don't, if you take these kind of precautions, there will be relatively less risk to your baby. Try to smoke outdoors. If you see yourself falling back into the habit, try to be away from the baby when you're trying to smoke, because you can't tell her that that's it, stop, right? But you can give her advice. You can encourage her for the steps that you're taking, motivate her towards this action that she has taken. Yeah. And give her some measures on if she does fall back to the same routine, what she can do. Wash her hands, wash her mouth before she has any contact with the baby. Maybe change her clothes after she smokes. Make sure she's in an open environment when she's smoking, right? Make sure the baby's not around, right?
Okay.
Right, that's an important aspect. And also, since the baby is there and she's worried about the smoke, you need to understand who else is there at home. Do they also smoke? Right, so that you can actually bring about those relevant aspects of the exposure of passive smoking exposure to the baby, right?
Yes.
Awesome. Let me take a look. And Dr. Hafsa, you had a question. Please go ahead.
No, I didn't have a question, but I just want to tell you that I submitted the this thing, but I couldn't mark the IPS thing. I saw later, but
Okay, okay.
I think he covered like almost 4 to 5 points, but I couldn't mark. Sorry for that.
All right,
Okay.
no problem. We'll take a
Okay.
look. I think your IPS was pretty good, but I would always tell you in IPS, if you look for an incident, like if you look for any way that you can actually give them extra motivation, use it to your advantage. Look for places where you can actually, use your IPS. Like, she's come for the smoking cessation, encourage her. It's a great step you're taking, and I really commend you for that. Use those words, how is your baby doing? That was good where you like, congratulations on your delivery. That was great. All right. How is your
Yeah.
baby doing?
Thank you.
Or, along those lines, use the IPS whenever you can. Awesome. Let's quickly look at the performance. Yeah, I think you had a very great start, but there are some important aspects that you ought to be covering, right? Like what is she here for? Like, she's actually here for the postpartum checkup, so make sure that is out of the way, and then talk about the smoking as such. Like, just 1 or 2 questions is fine. All right, let's quickly take a look. Greet Emily warmly, introduce yourself, and confirm the patient's full name. You didn't do that. I would give you a partial for this because I only mentioned Emily. In the question also, I didn't give you the name on purpose to see if you actually, because all these discussions that you have, you will be documenting them. Right, and the identifiers that you have is the age and the full name. So you can't just, there could be another person named Emily who's 32. It brings you more closer to who the person is. So you can't mess up that part. You can't discuss another person's medical condition with a wrong patient. That's a big no, right? So always keep that in mind. You have to make sure you identify your patients correctly by the information that is given to you, or seek for that information. That is full name and age. And if it's a telephone conversation, ask for the first line of the address. Yeah.
Okay.
Right. So, and confirm the full name. Yeah. Ask about the current smoking habits, including the number of cigarettes per day, frequency, duration, and duration of use. That's good. ICE. That was good. What exactly is her concerns and what is she expecting from today's consultation? So I brought in the fact of medications like on purpose to see whether or not you give me medication. So you mentioned that nicotine replacement therapy you can't give me because you said it might go in through the breast milk, but you never found out from me whether or not if I was breastfeeding. Right, so that's very important, even though because that's what should be running in your mind at this point. She's come for a smoking cessation clinic. In the question itself, it says that you're going to be talking about smoking cessation, so you need to think about the strategies. So out of the strategies, there are medications that you can be giving. So is it safe for this particular patient since she is postpartum? So not only postpartum, you need to think about lactation there, right? And that's good that you actually brought in the fact that's after I told you that I'm lactating and I'm really concerned if I can take these medications, right? So that's good that you did bring in that fact. But you can give nicotine replacement therapy. It does come to a certain extent into the breast milk, but it's not that harmful as compared to smoking, right? So to reduce the amount, you can give an additional advice to do the replacement after feeding, so that by the time it's the next feeding, relatively less amount of medication goes in.
Okay.
So nicotine replacement therapy is permissible postpartum. But what about the other medications? Do you know the other medications? So the other medications, I specifically asked you that I wanted other medications for craving. Do we give any medications for craving?
There is, but I've forgotten the name.
Yeah, that's all right. You can see that also might happen in the exam where you might know there is medication, however, you might forget the name. So you use that. Just say that there are certain medications that are given for craving, but unfortunately, I can't recall the name, or I can refer to my book. So always in every station, a BNF will be there in front of you. You can always point to it and say that I can refer to my book and find out. But if you're still not sure that whether or not it can be given in pregnancy, show that you don't know. Because quite
Okay.
frankly, when you're working as the doctor in NHS, you don't work as an individual doctor. You work as a part of a team. If you are lacking knowledge for something, somebody else might have that knowledge. Don't kind of rob them of that resource. That is again something that they want to see. If you give the wrong advice. Because
Okay.
if you don't, admit it, mention that I'll ask my seniors and find out, right? Because you're trying to give them a proper holistic care, and that's exactly what they want to see. Do you work as a team? If there is something that you can't offer, do you seek help and make sure that the patient gets it, right? So if there is medication, say that yeah, there are certain medications, but I'm not sure that if they are given, I can refer to my book, or I can speak with my seniors and find out. Yeah. And
Okay.
also something that they can also advise you properly in the smoking cessation clinic, where they can give you a better understanding of what medications you can use. You can always mention, from my understanding, I think nicotine replacement therapy is not given, but I will confirm that, or I can speak to my seniors to find out. But truthfully, it is given. And the other medications, Dr. Binish, I'll just get back to you. Let me just finish this thought. Yeah. So the other medications, which is bupropion, as well as vernicillin, this is something that you do not give, right? This is something that also gets into the breast milk, but unfortunately, there are not much evidence to see what are the adverse effects that the child has, right? So there are no much documentations on that, and hence it is actually avoided, right? Since it's actually something that works in the brain receptors, right? Yes, Dr. Vinesh, you have something to add? You have a question? Go ahead.
Yes, doctor. Actually, my question is like general for all scenarios, not specifically for this one.
Mhm,
Like you said that even if you forgot the name of medicine, you can say like that. So, for example, like we are having many cases in which we are giving antibiotics and all those things.
mhm,
So if you don't remember, we can just say that like we will give you antibiotics or we will give you some antidepressants, or like here if we say that we will refer you to the smoking cessation clinic So they may prescribe you some medications as per, your stage or like that, or we should tell the name of medicine itself.
See, one thing I want to highlight for all you guys is this exam
Mm-hmm.
is not to test your knowledge. They are not
Mm.
looking to see how much you know. That was the PLAB one. Over here, they're
Yes.
trying to see how you put your knowledge into work, how you would be working as a team, right? So if you know
Mm-hmm.
something for sure, mention it, right? But
Yeah.
like you will get additional points for it. It's basically how you put it into words, how you are working in a collaborative fashion. If you don't know it, it's better to admit to the fact rather than give the wrong information. So you can always mention it in ways that we can give you specific, we can give you. So usually when you're giving a broad spectrum, you usually go with cephalosporins or maybe penicillin types of drugs, right? So if you know that for a certain condition, maybe it might be a soft tissue infection, you know the dosage or you know the medication, then you can mention it. But if you don't know, you can always say that we will be giving you antibiotics specific to your condition, and in order to prescribe you those, right? So if you know it's antibiotics that is given, but if probably that patient might have a certain condition and you don't know whether or not you can give that antibiotic, admit to that fact. Usually we give this antibiotic. Unfortunately, since you are suffering from this condition, I may have to check with my book to see whether or not it is safe for you, or else I can always refer to my seniors to find out, right? So that way, even so, you put yourself in that perspective of the patient, right? Because no matter what you tell the patient will definitely agree, because that's the doctor's advice, right? So you don't want to give the wrong advice. You want to be clear about the advice that you give. Either you give the right advice, you be sure of that, or else you have resources to make sure that you're right. Right? You can refer to your book, you can avail senior help, right? Always admit to, the correct, you want to give them the right proper care. So whatever is preventing you from doing that, don't do that in the exam. Finish.
Yes. Thank you, Dr. Ali.
Thank you for that question. Awesome. Let's quickly look at your performance. Oh, wait, we did go through this. Yeah, we were going through this. Yeah. So ICE, we spoke about ICE. Now partially covered points. Establish rapport, acknowledge her postpartum period and motivation for quitting smoking. You never acknowledge the fact that I'm postpartum, and ask me a few questions about my health postpartum, right? So definitely she's come for a postpartum checkup. So get that out of the way. Ask her about her postpartum health, if there are any distressing factors that you need to probably give additional medical help for. Yeah. And encourage her for the quitting of smoking. Be like, that's a great step you're taking. Yeah. And the reasons, understand her reasons. That was good. That was good. You understood the reason. That was good. Like, is there any pressure? So you understood, and you understood the trigger. So that's good. So you can bring that back in management, saying that if at all your friends are smoking around you, try to avoid situations where you might fall back into the habit. That's an additional advice you can give, since you found out what the trigger is. Yeah. So always when you're asking questions and you find out things, bring it back in management. That actually shows you're listening. You get extra brownie points for that. Yeah.
Yeah.
Ask about baby's development and any issues during pregnancy. Yeah. Explore smoking triggers such as stress, social settings, or routine. I think I'll give you full marks on this one. Inquire about past quitting attempts and methods used, including what works and what doesn't work. Right. So you asked me that question. So you could have just elaborated, like, so in the past, have you tried quitting? What has worked for you? So that you can start your management for the things that worked for her. So it looks like she hasn't done anything because she's worried about it coming out in the breast milk. Right. So you can address that concern for her. And you can ask her, have you tried quitting in the past? Has nicotine replacement worked for you? Because then you realize that, okay, fine, that does work. So I can give it to her. Yeah.
Yeah.
What is preventing her from quitting? So some people have this thing like an oral fixation, where they find it very difficult to quit. So usually the replacement that is offered to them is in the form of lozenges or maybe some chewing gums, so that there is something for the oral fixation. So if you understand what is actually causing her, if that is an aspect, you can always bring it back in management as well. Yeah. Awesome. Inquire about, we spoke about this. Ask about the relevant medical conditions. Now you need to understand, if you're going to be giving her medications and all, you need to understand, does she have any other medical conditions, any allergies, right? Explore the history of asthma, depression, or complications during pregnancy. Ask about the current medical health supplements, any allergies to nicotine replacement patch or gums. Yeah. Ask about a living situation, presence of other smokers in the house. Yeah. Emotional well-being since childbirth, breastfeeding concerns, any recent changes, increasing triggers or smoking triggers. Yeah. So these are important questions. So since she's taken this step towards, reducing the smoke in her house, is there anybody else who smokes? Understand that. Understand where she is smoking, so that, you can give her preventive, strategies that she can use. Rule out rest flag. Ask about symptoms like persistent cough, breathlessness, or chest pain. Discuss her worries of withdrawal symptoms and impact on life. Yeah. Additionally, I would say in this question, understand how it affects. Ask about the baby's development. What does she understand about, how it would affect her baby, so that you can bring it back in management, where you can talk about, if you notice these issues in your baby, make sure to seek medical help. Yeah. Come in management. So management, explain about the benefits of quitting smoking, both for Emily and her baby, nicotine dependence and high motivation to quit during postpartum, right? So you can always motivate her and talk about the replacement. So you said replacement therapy. So always mention, what are you replacing, right? Because that's not mentioning the whole thing. Say nicotine replacement therapy, nicotine which you get from the tobacco can be replaced in other ways. Explain that, because you're not only giving management, you're explaining the management to a lay person. They might not understand. You have to go in with the thought that they don't know anything. You're filling them in, right? So try to be as lay as possible. Right? Offer nicotine replacement therapy and discuss its safety during pregnancy. Offer NRT options, which is short-term forms like gums, lozenges, inhalers that are safe in breastfeeding. Refer to behavioral therapy or smoking cessation, group support and structure. I think I'll give you full marks on this one. I'll give you half marks on this. Yeah. Discuss the potential side effects of smoking and secondhand smoke on the baby itself. Yeah, explain that nicotine replacement therapy is present in small amounts in breast milk and is less hazardous than secondhand smoke. Address the practical use of NRT, which is use NRT right after feeding to reduce nicotine levels in the next feed. That is an advice you can give. Avoid prescribing bupropion and varenicline while breastfeeding, since both can be excreted in the breast milk and their safety in infants is not well established. Yeah, that's why you're trying not to, do an experiment on this baby, right? So definitely, if you know it, mention it. If you don't know it, always seek help. Be cautious about that. Provide written resources. Even though you've had this conversation, it's not like she would be able to remember everything. So if she wants to refer back to something, give her some credible resources. NHS spends a lot of amount of resources in making these leaflets about all aspects of health. It could be diseases, it could be counseling, it could be a whole lot of things. Yeah. So offer the resources, the credible resources that you can refer to, rather than just doing a Google search or just asking their neighbor on what to do, right? So you want to give them something that they can rely on. Discuss safety precautions if relapse occurs, that is, no smoking indoors, change clothes, wash hands, maintain smoke-free environment. Arrange a follow-up in 1 to 2 weeks to monitor the progress and encourage the continuity and adjust plan if needed, right? So one other thing that I want to add is, usually children will develop some sort of a respiratory issue. They may develop asthma, they may have some wheeze. So if this is something that they realize or they encounter in their child, to bring them into the hospital, right?
Okay.
Those are the things you would want to say. What do you think happens to a child? So you usually have respiratory issues in the form of shortness of breath, grunting, any wheeze. If they suspect, bring them in for a checkup. Also, they may, their immunity might be disrupted. So that is also something that you realize that she's getting infections far too often. Bring her in for a checkup. So that's something that you can mention. Yeah.
Thank you.
No problem. So we'll quickly look at the interpersonal skills. Even though you won't mark, we'll just look at the points real quick. Show understanding.
I marked it separately. I submitted separately.
Oh, thank you so much, doctor. I'll go to the next one, which Dr. Hafsa marked, right? So this is the workbench where you get to see all the different strategies. Okay. Interpersonal skills, okay, so just mark the interpersonal skills. All right, let's quickly look at that. So show empathy, show understanding and empathy towards Emily's challenges in quitting. So once she says that I find it very difficult, I lack the sheer willpower, you can mention that it's okay. I mean, it's good to understand that you've taken this step, and that's a good way. That's a good step you've taken. For to break this habit. That's a start. Encourage on the good parts. Highlight those aspects that she's actually doing. Right? Encourage and motivate her by acknowledging her efforts to protect her baby. That's good. And continuously, I was saying, she's so little, she's so small. Like, I can understand. Yeah, and I'm so happy to hear on how caring a mother you are, or something along those lines. Yeah. Use clear and simple language to explain medical information. Again, replacement therapy. What are you replacing? Mention what exactly you want to say, right? So that even the patient knows what is the replacement you're talking about. So you're trying to get across to the patient in your strategy. So try to make her understand the strategy that you have in place for her, right? So active listening to her concerns and respond appropriately. That's good. Reinforce the positive steps that Emily has been taking towards a healthier lifestyle. Yeah, the benefits of quitting. Yeah, offer continuous encouragement and reassurance. So that was great, Dr. Shagun. I hope I could help you with this case. And there is a lot to understand in this case, because the nuance is that there is smoking cessation, and additionally there is postpartum. And along with that, you have to think about the child and breastfeeding. So there is a lot of things to think about, especially in this case. And this is an interesting case. It's a difficult one again, but it's an interesting case, and it does make you think a little. So that was good. That was a great effort, I have to say. Awesome.
Thank you.
Thank you so much. All right. So that was Dr. Shagun, who just did counseling. And guys, that brings us to the end of today's session. Thank you so much, everybody, for participating. I will be making a couple of blogs around, couple of topics that we discussed, like the measles and what to do when the vaccination is not given, and certain rashes in children. I've already made a blog on that, so I'll be reposting it in the group. So be sure to check that out and understand a little bit more about certain cases that we have discussed. All these cases that we have discussed is there in the workbench. This is the tool that we have prepared. By we, I mean Dr. Rohit and I. And not only that you can read about these cases, you can also check it out. You can also practice with an AI simulator, which we have incorporated. So if you go to the practice mode, you will be able to read more about this case, where we have laid this case, or we've arranged this case in the form of data gathering, management, and interpersonal skills, where you know the different aspects and the points to cover. We also have the doctor's instructions, where you know how these questions will be laid out in the exam. The simulator, what is the simulator's mindset, and we've also added a consultation guide that can help you incorporate the consultation in 8 minutes. So we have divided it into a 30-second chunk, which runs with
Begin. Enter the room.
every 30 seconds. It will be highlighting the important aspects that you can be saying in that 30 seconds. And we've also written a couple of questions on how you can express those questions. This is something that we have created, and we have had a lot of positive responses, where if you practice with the consultation guide, you would know what are the important questions to ask every 30 seconds as you go along. If you see next 30 seconds, it moves with the timer. And finally, we have the AI practice. So if you don't have a practice partner, and this is something that we've realized that, ultimately after having so much knowledge, it gets difficult to put it into words. So you can use the
Begin. Enter the room.
So guys, do check it out if you haven't already. We have a couple of free cases that you can try out. And if you're interested, we are making a group discount plan where if you have a group of 4, you can avail a 50% discount. So, well, thank you everybody for joining for today's call, and wish you the very best in your performance and your preparation. Thank you, everyone.